Wake up. It's the Sleep Unplugged podcast, episode 97, Nightmare Disorder. Night so cruel, I thought I'd die. Welcome, everyone, to the Sleep Unplugged podcast. My name is Chris Winter. I'm a neurologist, sleep specialist, and your host for this episode of the podcast. If you're new to the Sleep Unplugged family, welcome. If you're a veteran, welcome back. This should be a good episode of the Sleep Unplugged podcast. We're going back into some more sleep diagnoses. And this is an interesting one because a friend of mine I've known for a long time through my Major League Baseball connections wrote me recently and said, hey, my partner is dealing with sort of profound nightmares, and we're really struggling to find some information and help on it. So, Ben, this is for you. So, again, my name is Chris Winter. I'm a neurologist and sleep specialist. If you'd like to get in touch with the show, communicate about previous podcasts, give ideas for upcoming episodes, we would love to hear it. My social media is Dr. Chris Winter on Instagram. You can direct message me on there. Follow me on Instagram. You can follow me on Twitter. Again, Dr. Chris Winter. We have a YouTube page where we post all the videos of the content. I've written 2 books about sleep. One is The Sleep Solution, Why Your Sleep is Broken and How to Fix It. We had a big run at #1, but we are now not at #1, sadly. So, but it was fun while it lasted. Those 2 crazy days. It was really awesome to see it #1 on Amazon. So the Sleep Solution, Why Your Sleep's Broken, How to Fix It, and The Rested Child are my 2 books. We talk about music at the top of every podcast. One of my buddies, Scott, just wrote me and said, hey, listening to your podcast and really enjoying the music content. If you like the music that we talk about, want to hear it, we have a Spotify Sleep Unplugged playlist. If you look up Sleep Unplugged Spotify playlist volume 2, that is the volume we're on right now. Last week was volume 1. So our comment for this podcast comes from Michelle. Michelle wrote via the Instagram page and said, hey, my husband was diagnosed with idiopathic hypersomnia/narcolepsy with a daytime study test. She said that they're having, a lot of trouble finding a physician that writes for, the typical medications we talked about in last week's podcast. She said, listen, I love your podcast. I wait for it every Sunday night. You're enlightening. We really appreciate your ability to understand a narcolepsy patient's point of view. I really appreciate that. I got a lot of really positive content from my narcolepsy buddies out there. We at the Sleep Unplugged podcast see you, and we're advocating for you on a day-to-day basis. So really enjoyed last week's episode of the podcast on narcolepsy stories. And wow, we'll have to do a narcolepsy stories part 2, revenge of the narcolepsy patient, because I got so many great stories after the podcast that we could easily fill another 38 minutes of narcolepsy stories. So this week's podcast relates to last week's podcast in terms of the musical reference. Last week, we were really excited that Foreigner got into the Rock and Roll Hall of Fame. And that's where My Patience Has Reached Its End, Blue Morning, Blue Day. I said in last week's podcast, I was just in Cleveland, went to the Rock and Roll Hall of Fame, a gift shop, picked up this Station to Station Bowie t-shirt. And the other really exciting news from the Rock and Roll Hall of Fame induction was that finally Peter Frampton is being inducted. So where does this lyric come from? Night so cruel, I thought I'd die. It's actually from the David Bowie song, Never Let Me Down. Never Let Me Down was David Bowie's 17th studio album. How does that relate to Peter Frampton? Well, Peter Frampton was actually recruited to be a featured guitarist on that album and went on tour with David Bowie on his Glass Spider tour, which was his most over-the-top tour, which is probably the reason why he created Tin Machine. He wanted to strip it all back after that and do something a little bit more rock and roll. That was his 17th. Like I said, Never Let Me Down was his 17th studio album, widely regarded as one of his weakest, was recorded at Hell's Kitchen at Power Station. And Peter Frampton, who had known David Bowie since they were kids, they actually went to the same school, Bromley Technical School, where Peter Frampton's dad taught Bowie art. So they knew each other when they were young. David Bowie was actually 3 years older than Peter, and Peter had an amazing musical career, kind of toiled around with some bands. Humble Pie, I believe, was one of them. Went solo, really didn't have a whole lot of success, and just thought, I'm going to record this live album, which he did in 76, Frampton Comes Alive, which was a huge rock and roll album, one of the biggest live albums ever. I'd put it up there with The Who, Live at Leeds. I mean, it's just, there's a couple live albums you have to have in your collection, and Frampton Comes Alive was one of them. And he was on this sort of meteoric trajectory as this rock guitarist. Um, uh, and he made the mistake of posing shirtless on the famous cover of Rolling Stone, which kind of got him branded sort of a teen idol. And he really struggled after that to sort of get his career back on track. And he really credited David Bowie and Bowie's recruitment of him for Never Let Me Down to as really part of what kind of saved his career. So we'll put on there Never Let Me Down featuring Peter Frampton on our list. Might have to put on there a track off of Frampton Comes Alive. I was really struggling to figure out a Frampton lyric that lent itself to Nightmare Disorder. So, which is one of the reasons why we went with the Never Let Me Down, Night So Cruel, I Thought I Would Die, which I think is perfect. And we talked about Mick Jones of Foreigner last week having been diagnosed with Parkinson's disease. Peter Frampton was recently diagnosed with inclusion body myositis, which is another a sort of neuromuscular disorder, kind of in that neurology spectrum. He's 74 years old. He just had a birthday on April 22nd. So happy birthday, Peter. Uh, we think the world of you. Congratulations on your induction, and we'll get on with Nightmare Disorder. So Nightmare Disorder, we're back to talking about parasomnias, which again are unusual behaviors that accompany sleep. And this is the behavior or the problem that we see that's repeated over and over in this parasomnia are repeated intense nightmares that often create a sense of threat, or the individual not feeling safe or extremely stressed and upset during these events. There's often a threat to their security, so to speak. And these are often related to episodes stemming from REM sleep, which we would consider to be where nightmares typically come from. There is usually a very strong memory of them, which is part of the problem, is that memory of the trauma, the stress, the threat kind of creates a general anxiety often about individuals going to sleep. So that's very different than a night terror or a night terror disorder, which are often repeated awakenings out of deep sleep. And generally, there is no memory for those disorders. So nightmare disorder individuals often wake up, they're screaming, they're panicked. There is a narrative that goes along with them. They can vividly remember these events. And generally speaking, their heart is racing, they're sweating. And because of all that sort of sympathetic activation, again, we talk about sleep as being that sort of parasympathetic rest and digest. This is the opposite. These individuals are very much in sympathetic overdrive. They wake up and often have a lot of difficulty getting back to sleep because they're terrified. They may be sleepy, but their anxiety and vigilance is so revved up by the event, it can be very difficult for them to get back to sleep. So not only are they struggling when it comes to getting quality sleep, they're often, struggling to get back to sleep. Their sleep is fragmented by these terrifying events, but they often have a lot of anxiety during the day because of what they're expecting to happen at night. So the inability to fall asleep, sleep restfully. It's sort of like, hey, go to sleep, but we're going to wake you up and scare you at some point in the night. But you just go to bed. Don't worry about that. But at some point, we're going to terrify you with snakes or, threatening animals. Wolves are going to jump into your bed. So these individuals often struggle with the fear and anxiety that stems from these events, and usually happen in the latter part of the night, which is when more REM cycles are, versus night terrors, which are happening earlier in the sleep period. So it's thought about 4% of individuals, adults, have this disorder. It's actually higher to some degree in children, just because they're actually having a lot more nightmares when kids are younger. So 4%, the range is typically sort of quoted as 2 to 6%. It's often more problematic in women, with the ratio being sort of 2 to 4 women to every one man that has it. Unclear why this would be, if it has to do with higher dream recall ability in women. So it's not entirely sure why that sex prevalence exists. There is an inequality with aging. It becomes less prevalent in elderly women, probably because the lack of the changes in sleep quality and sleep depth that happens as people get a little bit older. For young people, ages 6 to 10, it's probably hitting somewhere around 40% of young people having sort of chronic nightmares, but not many of these children are meeting the criteria for the disorder, which we'll go over in just a second. They're having the frequent nightmares, but when you look at the criteria, okay, well, I have nightmares. Do I have nightmare disorder? And I think we've talked about this parasomnia before on the show. It's similar to the difference between seizures and having epilepsy. You can have a seizure through intoxication, sleep deprivation, a high fever. That doesn't necessarily mean that you have epilepsy, which is a syndrome of repeated seizures of some frequency or consistency. So the criteria for nightmare disorder is that you're having, number one, the presence of frequent nightmares that imply danger for the person and impact mood in a negative way. I have never in my career, I don't think, experienced a patient who says, man, I am having crazy, great, awesome dreams every night. Like, I'm going to fun parties. I'm having interesting experiences, like hanging out with people on the moon. Sometimes I'm an astronaut. Other times I'm a famous, entrepreneur, or I'm driving racing cars in they're never positive. When you talk to people with nightmare disorders, part of that memory, I think, comes from that sympathetic activation. My guess is, if people are having dreams that are relatively neutral or positive, it's probably less likely that they're awakening and having that activation that creates the memory of the dream. So number one, it needs to be frequent and negative. Number two, when waking from the nightmare, the person behaves in an alert way. And that's probably a differentiation between night terror, where the individual is awake, but they're not necessarily behaving in an alert way. They're kind of out of it. They go back to sleep the next morning, they have no recollection of it. The third, and I think the most important, and maybe the reason why so many young people don't qualify for the actual diagnosis, is that there needs to be a significant impact on the patient's personal, social, or professional functioning in areas like mood, sleep, cognition, behavior, fatigue, family interactions, and their occupational success. So that's really the key ingredient here. Is if somebody's saying, "Look, I have a lot of nightmares, but they don't really bother me, and in a lot of them, I'm sort of lucid and aware that I'm dreaming that wolves are attacking me, and it just doesn't really matter that much." Two things are happening. One, you're probably not meeting the diagnostic criteria of the disorder. Number two, that lack of anxiety is probably going to prevent the disorder from escalating. I think for a lot of individuals, the fear, anxiety, loathing of going to bed, knowing that there's a great chance you're going to have a terrifying dream that's going to awaken you, bolt upright at night, sweating, anxious, panicking is probably a big problem and part of the driving force of the disorder. So, what causes it? Number one, psychological extremes, anxiety, pressure, irritation, other kinds of mental disorders. Post traumatic stress is a big one. In a lot of patients who have this disorder, there is some sort of PTSD that's kind of pushing it. I think 80% of people with PTSD have frequent nightmares to the point where they're discussing it with other people. And these PTSD types of nightmares are often sort of grouped into one of three clusters: intrusive and re-experiencing. So I am having this, you know, intrusive dream that I keep re-experiencing the assault over and over and over again. So that's a big one. They often refer to the second cluster as numbing and the third cluster as being hyper arousing. Nightmares are usually considered to be a part of that PTSD experience, that you're reliving it over and over, not only in your thoughts during the day, but your dreams at night. Another big cause of nightmare disorder is our medications. There are a lot of medications that can be related to the occurrence of nightmare disorder. Amphetamines, and we talked about those briefly during narcolepsy stories. We often use amphetamines in our narcolepsy patients or our hypersomnia patients to help with wakefulness. Adderall is a common one. You may also see these types of medications used in individuals with ADHD. Antidepressants can be a cause of these medications, stimulants in general. So even outside of the amphetamines, some of the other medications we use as stimulants or wakefulness agents have been linked to it. And even non-pharmacological drugs like cocaine use can certainly be linked to nightmare disorder, as can high doses of caffeine. High blood pressure medications can be culprits. Levodopa, which we've talked about, I think, in the episode we did on restless leg syndrome, which is sort of an older treatment of that. It's also a treatment for Parkinson's disease, have been known to cause it as well too. You can also get into antipsychotic medications that one might use for schizophrenia. We had a writer or a listener write in a couple of episodes ago and say, "Hey, Chris, can you talk about antipsychotic use as a sleep aid?" Which is happening. We're when I say we, the medical community is increasingly using medications that you would think of for, antipsychotic use, Seroquel, et cetera, as actually being sleep aids, which they're really not. But if we're expanding the use of antipsychotics, and particularly into people who are not psychotic, those medications might be to blame as well too. So there are a variety of those types of medications out there that can be potentially causing this disorder. So, how do we assess these individuals? I think the clinical evaluation is most important. And as a neurologist, that's always what we're going to say. For whatever the disorder is, it's talking to somebody is always going to be the most important thing. However, those individuals may require a sleep study. And I think that sleep study needs to be done in a particular way. It's not a sleep study necessarily just looking for sleep apnea. We are probably going to be looking for an individual to have a sleep study with an expanded EEG montage. So we're looking for unusual brainwave activity, potentially even seizures, um, and some diaries that go along with it. Are there things that you do that seem to exacerbate you having the nightmare disorder? So we don't necessarily have to have an episode of the nightmare disorder present during the sleep study for the sleep study to be helpful, but it can, but if I could choose, can we have a test that the individual had a nightmare during the test or not? You would certainly choose to have the nightmare if possible. We often do sleep diaries as well too, just to be looking for patterns, not only in terms of what can we do to prevent these, but also, hey, it always seems like, Sunday night into Monday morning is when this individual is more likely to have the nightmare. That might be a great time to schedule the sleep study. Treatments, and there's not a lot of great ones. So I think that you kind of have to buckle yourself in terms of, what are we doing for these individuals to help with the disorder? I think number one treatment is try to figure out where these things are coming from. So if we can get lucky with finding a medication that might be problematic and eliminating it, that's great. Cutting back on caffeine, easy, illicit drug use, sure, anything like that could be really helpful. Anything in the environment, bed partner, noisy dog, noisy neighbor. Hey, ever since I moved to this house, I've been having a lot more nightmares. And those things, they can happen. They're not particularly rare. We've talked about reducing stress. We had an episode about yoga. We just did that awesome episode 95 on sleep and breath work. I think anything that we can do to reduce anxiety, ground ourselves. I think breathing exercises, yoga. We did an episode on yoga way back. I think all of those things could be extremely helpful in terms of individuals dealing with their nightmare disorder. There are medications that can be helpful in some cases. The most commonly used one for nightmares specifically is prazosin, which reduces that sort of sympathetic tone during sleep by well, I shouldn't say, well, sympathetic tone by blocking noradrenergic receptors. So prazosin is also used with PTSD patients as well. And I believe that that medication is a bit more effective if you can get it started earlier in the situation rather than later, but there's just not that many studies on prazosin for nightmare disorder specifically, but it's certainly something that can be used. Benzodiazepines are not a great class of drug for a lot of reasons. We touched upon benzodiazepines last week in the episode on narcolepsy, where I was talking about, hey, why are we talking about narcolepsy drugs being so dangerous and scary when people are giving out benzodiazepines left and right? So we want to be very careful when we're using these types of medications for nightmare disorder. Not a lot of evidence in terms of literature about their efficacy, but using these medications in some individuals, whether it's dealing with the nightmare disorder itself or acting as an anxiolytic, can be helpful. Once again, we're sort of back to the atypical antipsychotics. Olanzapine can quickly decrease nightmares in some patients. Risperidone, aripiprazole has been used in some cases. And aripiprazole was a drug that I stumbled upon for one of my patients with nightmare disorder that was wildly helpful for that individual. And we had tried a lot of things prior to that time. I really try to stay away from those types of medications, but this is what worked for them. Other medications that could be useful, clonidine, which is a drug that's often used in young people who have sleep disturbances, fluoxetine, gabapentin, trazodone. We're looking in that drug category of typically antidepressants that are having some sort of effect on neurotransmitters and therefore, downstream helping with the nightmare disorder. Eye movement desensitization and reprocessing, which is often called EMDR, is a specialized intervention to help individuals who are having disturbing memories and experiences. There is some evidence of this being potentially helpful in patients with nightmare disorder. I think the key here is finding individuals who are trained in the ability to do EMDR. There's really no negatives to it. So it's generally a very positive thing when people, it's either going to work or it's not going to work. There's usually no, downside to it, which is not what you can say about antipsychotics. Sort of CBTI, we have talked about a lot. It is an awesome treatment. It's like cognitive behavioral therapy and restructuring. There's also imagery rehearsal therapy, sort of a cognitive behavioral therapy where the patient is basically rescripting the nightmare. We do this a lot with PTSD patients. Your nightmare is you're always in bed and wolves jump in through your window and start attacking you. Maybe every night before you go to bed, as you're getting ready to fall asleep, you imagine the wolves coming in the room. And as soon as they come through the window, a dome of metal, covers your bed, and it's got little holes so you can see out of the holes, but the wolves are, scratching at the metal and they can't get in to see you. Or a dome of electricity encompasses your bed, and as the wolves jump towards you, they hit the electrical bolts that form the dome, and they're zapped and, you know, incapacitated every time they hit it. Or as soon as they come through your window, they magically turn into little puppies, and now the puppies are snuggling with you in bed. So you're changing the ending of the bad dream every night. And what starts to happen is your brain starts to pull your manufactured ending into the actual dream. So you're actually changing it. And that can be very helpful for individuals. And we've talked about this back, it was about a year ago when we talked about, because we're getting ready, in June, they have the big sleep meeting. And last year, about that time, we talked about interesting research that had come out of the sleep meeting, which was in Indianapolis last year. And one was a high school student who said, "Hey, I think maybe lucid dreaming could be a great tool to help individuals with nightmare disorder." So you start to empower yourself to understand that the dream that you're having is not real, which allows you to either terminate it or potentially change the ending of it. So again, instead of wolves coming through the window, there are puppies. And so there have been several studies that show that lucid dreaming therapy can actually reduce nightmare frequency, 80% of the time. And in a lot of those cases, total disappearance can be seen within a year of training this sort of lucid therapy. But I think that, available evidence is still a little bit thin. Systematic desensitization, again, is sort of all kind of part and parcel of the same thing, where you're trying to treat this chronic nightmare by reducing the emotion that goes along with it. So you're trying to create a sense of relaxation when the anxiety comes. So a lot of interesting thoughts about that, and not a lot of great treatments. I think that step one, if you're somebody who's having a lot of problem with nightmare disorder, is get a sleep study and make sure that that individual who's running that sleep study is looking for more than sleep apnea. We always say there's about 88 diagnosable sleep disorders. Sleep apnea is one of them. So sure, certainly, as somebody's developing sleep apnea, that could be the cause for waking up and having these problems. But if you don't have sleep apnea on a sleep study, the question is, did I have any of the other 87 diagnosable sleep disorders like acid reflux, nocturnal seizures, periodic limb movement disorder, whatever the diagnosis is? We want to make sure you're having a very thorough evaluation of your sleep and not just, yeah, you don't have sleep apnea. I think after that, medication exploration, and it might be sort of a trial and error kind of thing there that you're looking at for that. But as you're trying the medications, I would highly encourage you to think about yoga. Go back and listen to our yoga episode on from the podcast. That was episode 57, sleep and yoga. We did a wonderful one on breathing a couple episodes ago. That was sleep and breath. So focusing on that breath work, thinking about yoga, doing things to relax yourself can all be very helpful with your nightmare disorder. So that's it. Nightmare disorder done and dusted. We will put Never Let Me Down and a secret Peter Frampton song on the Sleep Unplugged Spotify playlist. Congratulations, Peter Frampton. More information about nightmare disorder, you can find my books, The Sleep Solution, Why Your Sleep's Broken and How to Fix It, as well as The Rested Child. If you have children you suspect might have sleep disorders, follow us on Instagram, follow us on Twitter, follow our YouTube page with our Sleep Unplugged videos. And until next week, like and subscribe to the podcast and write a review if you have time. And until next week, sleep well.